Hello, everyone. Our topic today is about cupping therapy. Cupping therapy was documented and endorsed in diverse civilizations, including Egypt, Greece, China, Rome, and also it's been in the tradition in the Arab Peninsula. Um, and the Prophet Muhammad has spoken highly about cupping therapy, especially the wet cupping. We're going to explain it later. In the traditional Eastern medicine, cupping therapy was closely associated with acupuncture. So the idea of using cupping is to harmonize the chi by balancing the yin and the yang. As you know, the yin and yang are basically metaphors for the negative and positive forces in the body and in the universe. If there's a blockage in these channels, or what we call the meridians, as it's been mentioned in Chinese medicine, usually it's associated with pain. And thus, doing cupping or doing acupressure or acupuncture, the whole principle is to, get this channel flow again back to normal. And this should get rid of the pain. Of course, in other traditions, the cupping has different meanings. These are some of the famous cupping. I don't want to say points more than it's an area, cupping areas. And one of the famous one is the one in the middle of the head, and also the governor vessel of 14. So governor vessel 20, which is in the middle of the head, and also governor vessel 14, and other points as you see, like gallbladder 21, and the other bladder channel points. But you cannot compare acupuncture with cupping. Cupping is an area, it's not a point. Okay? So, what is the mechanism? There are different mechanisms. And one of them is the pain gate theory. The other one is the diffuse noxious inhibitory or DNIC theory. Also, it's believed that cupping releases nitric oxide, activate the immune system, detoxify the blood, and also works like a reflex zone area, like reflexology. Okay. And lastly, but also very important, is a cupping is considered some kind of a regulation therapy, like neural therapy, like acupuncture. It regulates the whole body system. So the gate theory, as you know, is a very important and fundamental theory developed by Patrick Wall and Ronald Melzack in 1965. And simply, it's about stimulating large fibers that will block the pain, away from the small fibers, okay, like the C fibers. That's the whole theory about the gate theory. and it's very fundamental in pain management. All right, these are Patrick Wall and Ronald Melzack. Both of them passed away. I think Melzack passed away in 2019 or something like that, and Patrick Wall earlier on. So again, stimulating large A beta fiber blocks the pain through the C fibers. Another concept is called the DNIC, or diffuse noxious inhibitory control. With DNIC is stimulating painful areas can stop pain from another area in the body. So this is like if I stimulate pain in a distal place, this will stop the pain from the area that's hurting you. And on humans, this phenomenon is called conditioned pain modulation. Again, the DNIC, okay, and the connections that lead to the DNIC. It's a very important phenomenon, by the way, in pain management. Another theory is releasing nitric oxide. And it's been shown that nitric oxide can cause vasodilatation and local physiological responses, and thus it might lead to reduction in pain. And as you see here, you know, doing the cupping itself via the shear strength that you see with the cupping, this can release nitric oxide. Another theory for cupping is activating immune system. As you see in this picture, cupping brings up all kind of immune cells, and thus it helps with activating the immune system. Besides activating, the blood flow itself. Okay. And there's a question that a lot of people ask about is the blood that we see with the cupping, where it comes from. It comes from three different places. It comes from the capillaries, comes from the interstitial tissue, and it comes also from the lymphatics. Another theory is the blood detoxification theory. They found that the blood, especially with wet cupping, that comes out have higher concentrations of uric acid, cholesterol, urea, and triglycerides. Another important theory is the reflex zone theory. What is the reflex zone theory? That each part of the body has a reflection on the outside of the body. For example, the heart, the lungs, the liver, all of these has some sort of reflection in the outer side of the body. So if you stimulate these dermatomes from outside the body, you will affect these organs. This is what we call the cutaneous-visceral connections. And we have also viscerocutaneous connections. For example, a patient has a heart attack. He will be hurting in his left shoulder. Or a patient with a gallbladder disease will hurt in his right, and so forth. This is called viscerocutaneous reaction or reflex. So we have, according to what we call segmental therapy, we have, area that represents each organ. on the outside of the body. These are called the head zones. They were developed by Dr. Sir Henry Head, a British neurologist. And this is a nice picture, show you the, that if you stimulate its a cutaneous area and how it relates to a visceral organ. These are the head zones. As a pain physician, you should know these areas. And this is kind of a segmental focal zone map to different organs of the body and how they represent in the outside. Again, the sympathetic supply for the body, the head and neck, T1 and 2, upper extremity 3 and 4, thoracic viscera in general from 4 to 6, T4 to 6, abdominal viscera from T7 to T11, and the lower extremity from T10 to L2. Last theory is regulatory therapy. So we do believe that cupping has to do with increased power of resistance in the organism. And it regulates the whole system. This is a terminology that was put forward by the Hunicke brothers from Germany in the 50s of last century. And they developed a technique called neurotherapy. And they found that this neurotherapy techniques can regulate the body unless there is a focal zone or interference zone. And of course, if there's an interference zone, you need to deblock it. I have a very nice presentation about neurotherapy under the name of biomedical injection therapies, if you want to refer to it. These are the different organs and how they represent the outside of the body. So let's get into the meat of this lecture here. What is the clinical significance of cupping? Well, cupping has demonstrated notable advantages in various forms of pain, especially musculoskeletal pain, migraines, and tension headaches. Studies indicated that wet cupping reduced the average headache severity by 66% and decreases headache days by 12.6 per month. So this is, I consider it very good results. Okay. So also alongside the headaches and musculoskeletal pain, cupping has been shown to help in other types of pain, like neuritic and arthritic pain. A German study showed that traditional wet cupping helps in treating carpal tunnel syndrome. Other uses beside pain, it's been shown to have some evidence in some autoimmune diseases. I don't want to get into this area because really this is outside my scope. So these are the, some of the indications of cupping: arthritis, back pain, neck pain, asthma, carpal tunnel, IBS, headaches, migraines, and high blood pressure. These are the famous indications for cupping. There are, so many indications in the literature. When I However, these are not really backed up by evidence. So what are the cupping methods? We have three types. We have the dry, the massage, and wet cupping. So the dry cupping is do the cupping, just with a cup. You can, use a pump. You can use heat to get rid of the air inside. You can use the cup as a massager, okay, with some oil, and you can massage the body with it. And usually in a vertical, position. Wet cupping is we induce some scarification in the skin, and this helps bringing the blood out when you do the cupping. Of course, this is done by special sterile blade. It's usually a blade number 11, and it is really all you need to do is to just scratch longitudinally in the area where you're going to do the cupping here. All right, just very, very superficial and very, small amount, like, we're talking a millimeter or so. So this is dry cupping. This is wet cupping, as you see. The blood is coming out. And by the way, the amount of blood that comes out is pretty small, right? Those that get a little bit dizzy after the procedure, it's not because of the blood that was taken from them. It's mainly like a vasovagal reaction. That's why you have to really explain things to the patient. And also the patient has to be MPO, except for fluids. This is a kind of, blade that you can use for, you just use the tip of it and just do a very small, tiny scratch in the skin. All right. This is the cupping massage, where they use the cup, and they move it up and down with some oil underneath, so it can help with moving the cup. How about pumping methods? We have manual pumping. We talked about it. And then we have electrical pumping. I use this, sometime here, and I couldn't find it's really very efficient. I do believe just manual pumping is more than enough. And then you have fire cupping. And this is nice because it warms up the cup when you put it in the skin. So you put like a cotton, burnt cotton inside the cup, and then you put the cup on the patient. And this gives nice and warm feeling to the patient. So this is the fire cupping therapy. This is the manual cupping. This is dry cupping. All kinds of cupping, by the way, is dry. Whatever, comes in your mind is dry, except only one type, which is the wet cupping. And thus the wet cupping should be, put, in advanced cases, not as a beginner. You start with wet cupping. You keep the wet cupping for difficult cases. This is the electrical cupping. It's nice and easy, but it's really, you lose the control and the feeling that you have with the manual cupping. But you can use it. I don't see a problem with it. Okay, so again, what kind of cups we use? We have different cups. We have glass cup. These are the traditional ones that widely used. There are silicon, there are plastic, there are bamboo cupping, and there are ceramic cups. Each one has an advantage over the other. As you can see, this is just to give you an idea about different. This is the bamboo cupping. This one is plastic, glass. What should you expect after cupping? You will find a rounded area where they did the cupping. Looks like pepperoni, sort of. All right, and it should not be, very painful. It should give you some little discomfort, but the skin part of it is it will remain with you at least a week. So this pepperoni-like, figure, it will stay with you at least a week. What are the adverse effects of cupping? I mean, since you're working, and you're using the skin and you're sucking the blood from underneath the skin, you might have a bruise, you might have darkening of the skin, paniculitis, a Koebner phenomenon with psoriasis. Of course, you can have an infection, and thus you have to really be very careful about, cleaning the machine that you're using it only one time and you throw it away. Okay, and this kind of things. Use gloves, do betadine or alcohol before you put the cups on, and so forth. So let us talk just a second here about the evidence-based medicine. Up till now, as far as evidence-based medicine, we have a low to moderate evidence that cupping helps with the pain in musculoskeletal pain and myofascial pain syndrome. So this is the main indication. Take-home messages. The evidence indicates that both dry and wet cupping techniques can offer substantial benefit in pain management, with potential advantages varying depending on the pain condition that being addressed. Dry cupping has exhibited efficacy in managing generalized pain conditions, whereas wet cupping demonstrated significant benefits in alleviating inflammatory-related pain conditions, such as shingles, for example. Cupping therapy is currently regarded as a complementary technique rather than a substitute for conventional medical treatment. This statement is so important for you guys. This is not a replacement to what you're doing. This is a complementary technique. These are my references. I like this nice little book, Art of Cupping, by Dr. Hedwig Mans from Tima Company. And then you have the segmental anatomy by Dr. Ingrid Camping. Okay, thank you so much. If you have any questions, please write it in your comments. Thank you.